Welcome to Module 3 of the Tobacco-Free Futures Implementation Series, Preparing Staff. Tobacco-Free Futures is an integrated health systems tobacco cessation model developed for Alberta Health Services to provide support for Albertans who use tobacco products. This module refers to the content found in Chapters 10 and 11 of the Tobacco-Free Futures Guidelines. These two chapters cover communication and training, which are essential for successful implementation and sustainability of this initiative. Information, tools, and resources are provided in the guidelines for site management and steering committees to support these processes. As with anything, a plan is the best place to start. It's essential to have a strong communications plan throughout all phases of implementation and to use the right messages to reach your key audiences.
A robust communications plan is a key element in successfully implementing the Tobacco-Free Futures program. It requires a lot of engagement and awareness with key audiences and stakeholders at a site, including staff, physicians, patients, clients, as well as the general public. For sites that are implementing the Tobacco-Free Futures model, we do have a series of templates and resources that have been developed and are pre-populated for them. They're certainly not the be-all, end-all of resources. We know some sites are very unique and may need some additional supports. So we are there. The communications department is there to support them. All they need to do is reach out and engage with us. Our contact information is all on Insight, or if they're not sure, they're more than welcome to contact myself, and we would be happy to support them in getting the message out to their staff as well as to their patients and clients.
The Tobacco-Free Futures Guidelines provide a list of suggested tasks for communications during implementation. Templates for various communications tools have been created for your use, such as email invitations and memos for staff.
We knew that communication would be critical in this whole process, so right from the start we made sure that we had some means of keeping staff informed of all the changes happening, whether it be minutes from the steering committee or interaction with other groups, and that we had an electronic file available that all staff could access at any time and remain up to date. We had some communication often at all our staff meetings, updates, had more open venues where discussion could happen, and feedback was welcomed by all staff, so that was a big part of it.
Posters and signs have also been created, which can be used in your site. They include materials both for AHS staff and the general public, and are available for ordering.
We made very good use of the communications section in the Tobacco-Free Futures resource binder as a template for what we did on this site. And we followed advice. We have new signs, we have new posters. We did a lot of work through email messaging to unit leaders and program leaders and to frontline staff. We did education sessions with frontline staff. We attended a lot of staff meetings on the units and in other areas as well to spread the word about what was going on with Tobacco-Free Futures, where we were at, what the status of the program was or implementation was, and especially what we wanted them to be able to do in the future, why it was important that they be able to do those things, how it would benefit patients.
Display kiosks are available for zone-wide sharing and can be accessed through TRU at albertahealthservices.ca. The display includes banners, backdrop, and resource table suitable for a manned display. Further guidance is available from the AHS Communications Department to help you connect with your audiences.
Tobacco use has certainly had a big presence within my family. I remember growing up and we'd have birthday parties, and of course back then it was the norm. People would smoke in houses and not think about it. And we look back through videos now, and both my grandmothers, are smoking at a birthday party, and we're in the house, and my brother and I are right there exposed to it. And of course now, the more we've learned about second and third-hand smoke exposure and the dangers associated with that, I look back and think, wow, geez, I certainly don't want my children or their children to be exposed to that as well. There still continues to be some tobacco use in my family. I just recently supported my husband to give up his spit tobacco, which is great. He did reach out and utilize some of the supports available through Alberta Health Services, which I knew about but was able to kind of guide him towards, I think. So I've seen it, and I've seen the health effects of it. I've lost people because of it. So it certainly is a motivating factor for me personally to want to provide the best support that I can from a communications perspective to support sites in implementing it, and to support other staff members to get that message out there.
Given the well-known connections to increased rates of cancer and chronic disease, as well as poorer health outcomes and an ongoing burden on the healthcare system, it is more important than ever that healthcare providers are able to support clients and patients who use tobacco.
Unfortunately, in the past, most, if not all, healthcare professionals had very limited information or training related to the management of tobacco dependency. Some individual healthcare professionals who had special interests in the area have taken advantage of opportunities to increase their knowledge and awareness and that. So with the Tobacco-Free Futures guidelines, one of the key things that we identified was the need to provide training to help support healthcare professionals and that. And so there is a variety of training that is available to healthcare professionals, ranging from relatively short online courses to more in-depth in-person training.
AHS competency-based tobacco training programs will enhance the quality and consistency of tobacco cessation support in Alberta by providing healthcare professionals with the knowledge and the skills they need, and helping to promote positive attitudes to help tobacco users. Refer to Chapter 11 of the Tobacco-Free Futures Guidelines for more details on the available tobacco training and how to access these opportunities. Healthcare providers offering varying degrees of support will require different competencies to carry out their responsibilities. A variety of training opportunities are available to meet these needs.
We do offer different kinds of training, in the province, whether it's brief intervention, which is online training, doing intensive cessation counseling, which is our track workshops, or we will be launching an online course this fall for that as well. And we do offer quick core professional training, for people who are going to do group. The information about all of that is on the healthcare provider section of the Alberta Quits website.
AHS offers tobacco cessation treatment training programs for brief to more intensive interventions, as well as training for specific populations such as mental health clients. Site capacity building training includes the implementation workshop and tobacco practice lead training to help prepare sites for implementation and ongoing sustainability.
Setting a go-live date, or that optimal date, really can't occur. The go-live can't occur until training is complete, because training and communication really prepares the staff for being able to go ahead and start to do implementation of the full tobacco treatment option.
Initially, there was huge resistance. Why would we do this to people? Are we infringing on their human rights? It's going to be counterproductive. They're always going to be, the clients are just going to be talking about wanting to smoke. They're not going to be able to do the work that they have to do, that they came into treatment to do, and just almost right from the start, when the counselors were able to participate in some of the training and that, like the track training and learning about the role of tobacco cessation in treatment, that kind of opened their eyes a little bit about what the goals are for for what we're trying to get across and why we're doing it, right? And then once the clients start getting into it and the counselors realize that the clients are healthier, right, and they're using the skills that we're teaching them in the moment, right? So I think that's good feedback for the counselors too. They get to see that this isn't something that they used once they encountered a high risk situation back home. They used it when they were here, right, dealing with a craving or an urge. So been a huge change in that, and right across the board, the staff are completely in line with this now, from my perspective.
Communication and training are going to play a big part in the success of the implementation of this program. Please refer to the TFF guidelines for more in-depth information on the communications tools and training available for your site. If you're ready, let's move on to Module 4, Sustainability and Continuous Improvement.